Welcome to Chapter 2, Promoting and Preserving Your Psychological Health. Psychological health contributes significantly to our quality of life, and our ability to appreciate life is directly related to our psychological health. So the first question that we need to ask is, what is psychological health? Well, it's the sum of how we think, feel, relate, and exist in our day-to-day lives. It encompasses our emotional health, social health, mental health, and spiritual well-being, our spiritual health. Psychologically healthy people share many of the same basic elements. They feel good about themselves. They feel comfortable with other people and have respect and compassion for others. They are self-compassionate. They control tension and anxiety. They meet the demands of life. They curb hate and guilt. They maintain a positive outlook, value diversity, and appreciate and respect the world around them. Basic needs must be met before we can achieve characteristics of psychological health. And so here's a diagram of Maslow's hierarchy of needs. And this idea is that we need to start at the bottom level, the survival needs: food, water, sleep, exercise, sexual expression. Once those needs are all met, we can level up to shelter, safety, protection. Here's the thing. The levels that are in blue, if our brain is concerned with where am I going to get my next meal, do I have a roof over my head, where am I going to sleep tonight? If those things are things that our brain is worried about, our brain is wired for survival. And so if our brain is on those blue levels, we are not going to be able to get to the higher levels of social needs, belonging, affection, acceptance, self-respect, respect for others, and accomplishment, let alone the highest level, which is self-actualization and the fulfillment of potential. So each level needs to be met in order to truly recognize self-actualization and for a person to be truly healthy, according to Maslow. Mental health describes the thinking or rational part of psychological health. A mentally healthy person perceives life in realistic ways, can adapt to change, develop rational strategies to solve problems, and can carry out personal and professional responsibilities. A mentally healthy person has intellectual health, or the intellectual ability to learn and use information effectively and to strive for continued growth. Emotional health refers to the feeling or subjective side of psychological health. It's what happens in the right side of our brain. Emotions are intensified feelings or complex patterns of feelings that include love, hate, frustration, anxiety, joy. Emotions are energy in motion. So when the emotions happen to us, we can happen to the emotion. Energy comes in, energy can go out. Emotionally healthy people respond appropriately to upsetting events. In contrast, emotionally unhealthy people are more likely to let their feelings overpower them. That right side of the brain takes over the left side of the brain, which is the logic, and everything kind of goes out the window. Emotional intelligence refers to the ability to identify, use, understand, manage those emotions in a positive, constructive manner. Mastering our emotions is truly a feat and an undertaking that takes many people a really long time. Social health includes your interactions with other people, your ability to use social resources and support in times of need, and your ability to adapt in a variety of societal situations. Families have significant influence on psychological development. Children raised in dysfunctional families may have a harder time adapting to life and run an increased risk of psychological problems. Presence of key social support consists of networks of people and services with whom we share ties. This includes tangible support, money to pay bills, and intangible support, encouraging you to share your concerns. Loneliness is a feeling of emptiness or hollowness, causing people to feel alone and unwanted. It's increasingly common among college students. And some health risks that are associated with loneliness include depression and suicide, increased stress levels, antisocial behavior, and alcohol and drug abuse. Spiritual health is much broader in meaning than religion, and it's defined as an individual's sense of peace, purpose, and connection to others. And the beliefs about the meaning of life goes beyond material values, and it's practiced in a multitude of ways. It refers to the sense of belonging to something greater than physical or personal dimensions of existence. There are factors that influence psychological health, such as family, support system, community, self-efficacy, and self-esteem, which the difference is self-efficacy refers to your belief on whether or not you can successfully engage or execute a specific behavior. Our self-esteem refers to our sense of self-respect or self-worth. And with underneath that, there's a learned helplessness versus learned optimism. And learned helplessness is a response to continued failure, right? We perpetuate that. We put barriers in the way of our success, which people end up giving up, right? When they have that learned helplessness, it's everybody else's fault. There's no way that I can do it. And they've failed to take action for themselves. Our personality, right? That is it's hereditary. There's environmental implications, cultural implications that come into our personality, as well as experience, right? Other factors are lifespan and maturity. And something that's not listed is our emotional intelligence. And it's our ability, emotional intelligence is our ability to identify, use, understand, and manage our own emotions and those of others. Our emotional intelligence quotient is an indicator of social and interpersonal skills. Your ability to successfully maneuver in emotionally changed settings. So it's self-awareness, self-regulation and self-management, internal motivation, something we need a lot of with those behavior contracts, empathy, and social skills. I just want you guys to kind of take note of this slide here. Like many other areas of health, psychological health, it's not an all or nothing measure. And this demonstrates the continuum. The slide demonstrates a continuum that psychological health, right? It's kind of like a spectrum. And you really want to be more towards the green as much as possible, right? That's what we're shooting for. But if we have awareness about the other, right, the unhealthy bits, then we can implement action to start shifting back over to the health side. At the core of the mind-body connection is psychoneuroimmunology, and it is the study of the interaction of the behavioral, neural, and endocrine functions and how they affect the functioning of the body's immune system. Happiness is a collective term for several states in which individuals embrace the world around them. Hopefulness, optimism, and contentment appear to reduce the risk of some chronic diseases. We'll get into this in the next chapter. Stress is one of the number one proponents of illness. So it, to me and to many others, it stands to reason that if our brain with stress can induce illness, that hopefulness, optimism, and contentment can help to create wellness. According to Martin Seligman, who is the man seen as the father of positive psychology, and which is what that's the foundation of my practice, is positive psychology. Mentally healthy people have certain strengths and virtues in common. Okay? They have high self-esteem. They're realistic, forming realistic expectations. They make time for you, maintain physical health. They approach life with excitement and energy. They think things through and examine things from all sides. They seek help when needed. Get adequate sleep. So important. Well, I'll dedicate an entire chapter to that as well. And use PERMA. So what's PERMA? PERMA is an acronym representing 5 elements of well-being to help humans flourish. So P, positive emotions. Engage in behaviors that bring you joy. Be kind. Be curious. Engagement. Adopt mindfulness. We've talked quite a bit about that, haven't we? Invest time in activities that absorb you. Get into a flow state. Relationships. Build new relationships and deepen existing ones. Meaning, consider your legacy. What do you want others to remember you for? Achievement. Set realistic goals and pursue them. Put effort into your life. When psychological health deteriorates, a number of things can become prevalent. Increased stress, abusive relationships, anxiety, loneliness, financial upheavals, and other trauma can derail coping resources. Mental illnesses are disorders that disrupt thinking, feeling, moods, and behaviors and cause varying degrees of impaired functioning in daily living. The most common risk factors are genetics and familial disposition and excessive unresolved stress, right? Stress happens. It's going to happen all the time, and we'll talk about the differences of stress, but we need to resolve it. An estimated 17.9% of Americans, that's 1 in 5 Americans, aged 18 and older, 1 in 5 adults aged 18 and over, suffer from a diagnosed mental disorder yearly. And many suffer from more than one at a time, which is called comorbidity, 2 happening at the same time. Mental disorders are the leading cause of disability worldwide. Mental health problems are common among college students, and they appear to be increasing both in numbers and severity. The National College Health Assessment Survey, it illustrates some of the difficulties college students face today. Anxiety and depression are at the top of the list of those mental problems. So here we have a look at what are some of the top things that people your age are seeing. So felt overwhelmed by all that they needed to do, 86%. Felt things were hopeless, 50.9%. Felt so depressed that it was difficult to function, 38.2%. Seriously considered suicide, 10.4%. Intentionally injured themselves, 6.9%. And actually attempted suicide, 1.9%. We are going to shift into some of the disorders, and I want to make a disclaimer here that you may have some of the identifiers that we talk about, right? Some of the symptoms that we talk about as we go along. I want you to know that it takes a lot more than just what we're talking about here to make a diagnosis. And so I don't want anybody self-diagnosing themselves, okay? Okay, so mood disorders. Chronic mood disorders are disorders that affect how you feel, such as persistent sadness or feelings of euphoria. Euphoria is like elevated mood, really happy. It includes major depression, persistent depressive disorder, which is dysthymic disorder, bipolar disorder, and seasonal affective disorder. Major or clinical depression is severe depression that entails chronic mood disorder, physical effects such as sleep disturbance and exhaustion, and mental effects such as the inability to concentrate. Approximately 9% of the U.S. population is affected by this each year. And so it's characterized by a combination of symptoms that interfere with work, study, sleep, appetite, relationships, and overall enjoyment for life. Depression in college students can be a major obstacle to academic success and healthy adjustment. So here listed are some of the symptoms. Again, no self-diagnosis, but let's be mindful. Again, depression for humans your age can be a major obstacle to academic success. Students who have weak communication skills, who find that college is not what they expected, or who find that people they know seem different, they often have difficulties. Of college students, 13.9% report having been diagnosed or treated with depression in the last 12 months. And this is why the college here has the SAP program for you guys to utilize in times of need. So dysthymic disorder or persistent depressive disorder, PDD, it's a less severe type of depression. It's milder, it's chronic, right? That means it's pretty much lifelong. It's harder to recognize. It's often characterized by fatigue, pessimism, or short temper. Think about, if you guys know anything about like Winnie the Pooh, Eeyore. Eeyore would be classically diagnosed with PDD or dysthymic disorder. Bipolar disorder. It's characterized by alternating mania and depression. It's also called manic depression. Not so much anymore is it called manic depression. It's typically bipolar. It's often very much misdiagnosed and overdiagnosed. Seasonal affective disorder, sad, ironic, right? It's a type of depression that occurs in the winter months when sunlight levels are low. So it's not just sunlight, it's our vitamin D levels drop. And in this area, we have, we're really close to the mills. And so most people around this area have a lower level of vitamin D, which can promote seasonal affective disorder. So light therapy and vitamin D are often utilized in treatment of that. Mood disorders are believed to be caused by many factors. There's not just one identifier, okay? So there's biological differences, hormones, inherited traits, life events, and early childhood trauma. Several types of depression that have a genetic component, including bipolar disorder. And depression can be triggered by serious loss and severe life events. Making the shift over to my favorite, anxiety disorders. They're mental illnesses characterized by persistent feelings of threat and worry in coping with everyday problems, right? And the future. And they are our largest mental health problem here in the United States, affecting more than 40 million people in any given year. Don't want to give it to more people than have it. Generalized anxiety is common. It's a common anxiety disorder, and it can be severe enough to significantly interfere with daily life. To be diagnosed, one must exhibit the following symptoms for more days than not over a 6-month period. Restlessness or feeling keyed up or on edge, feeling being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and or sleep disturbances. Panic disorders are characterized by panic attacks, which can also happen with generalized anxiety disorder. An acute anxiety reaction that brings on an intense physical reaction. Anxiety is a very physical disorder, right? A lot of stuff happens in our body to let us know that anxiety is happening. We might have elevated heart rate, sweaty palms, tingly feet, foggy head. A lot of different actual physical symptoms go along with anxiety disorders. Phobic disorders involve persistent or irrational fear of a specific object, activity, situation, often out of proportion to the circumstances. Social anxiety disorder, or social phobia. It's an anxiety disorder characterized by the persistent fear and avoidance of social situations. So what causes anxiety disorders? We don't really know 100%. There's not like one, again, identifier. The causes may be biological, environmental, or within cultural and social roles. Obsessive compulsive disorder, OCD, occurs when people feel compelled to perform repeated rituals, right? They're fearful of dirt or contamination, have an unnatural concern about order, symmetry, exactness, or having persistent intrusive thoughts that they can't shake. Post-traumatic disorder, PTSD, it happens when people have experienced or witnessed a traumatic event. They may develop post-traumatic disorder, PTSD. There's also secondary PTSD when first responders come to a scene of a crime, when therapists are working with trauma clients repeatedly, and there's a particularly intense trauma that they're working through. There can be secondary or tertiary trauma. So some of the symptoms that go along with PTSD include dissociation. So that's the mind dissociates from the body, and that is actually a coping skill so that the person isn't reliving the trauma over and over. Intrusive recollections of the traumatic event. And acute anxiety or nervousness, insomnia and difficulty concentrating, intense psychological reactions when something reminds the person of the traumatic event, heightened awareness, heightened arousal, nightmares, all very prevalent with PTSD. So again, the causes of anxiety disorders, so there's biological. Some scientists have traced the origin of anxiety to the brain and its functioning. There is parts of our brain that do fire off hormones and chemicals into our body to help when there's an actual threat, and then at times our brain will misfire when the brain is experiencing a perceived threat. So there's not a threat actually happen, but our brain perceives something as threatening. Environment. Anxiety can be a learned response. Somebody who grows up in a very abusive home, who experiences childhood trauma, anxiety can be very much a learned response in that. Social and cultural roles. These may also be a factor in the risks for anxiety. So there are multiple factors at play here. So according to the Diagnostic and Statistical Manual of Mental Disorders, this is the only way that you should ever be diagnosing. You shouldn't be diagnosing, but that's the only way that anybody should be diagnosed, is by going through that manual. It's the psychotherapy Bible. A personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture and is pervasive and inflexible. So it's different than what is going on in the norm, right? It's pervasive, it's causing dysfunction in life, and it's inflexible. They can't change it if they want to. Common types of personality disorders include the following: paranoid. That's pervasive, unfounded suspicion and mistrust of other people. Irrationally jealous and secretiveness. Narcissistic personality disorder. I know quite a few of you have probably heard, oh my gosh, he's a narcissist, blah, blah, blah. She's a narcissist. NPD is actually not diagnosed very often. There's a very small amount of people who actually have narcissistic personality disorder. We all have narcissistic tendencies and we need them for survival. But NPD is an exaggerated sense of self, self-importance and self-absorption. So, and other things come along with that, like gaslighting and, I am just everything I say goes. It's golden, so on and so forth. Borderline personality disorder is characterized by impulsiveness, risky behaviors such as gambling sprees, unsafe sex, drug use, and daredevil driving. Things that are just very emotionally erratic and a lot of severe emotional instability. Schizophrenia is not as common as the movies make it out to be. It affects about 1% of the U.S. population, and it's characterized by alterations of the senses, right? So our senses, the way that we feel, smell, hear, see. It's an inability to sort incoming stimuli. So the brain does not categorize what it is receiving to make a correct response. So there's a glitch in the system. There's an altered sense of self. Radical changes in emotions, movements, behaviors. So sometimes people will have like auditory hallucinations. They will hear things or people that aren't there because the brain is having some pretty significant misfiring and it's not sorting the incoming stimuli that's coming in. We cannot have a conversation about psychological health without the discussion of suicide. And a lot of people are afraid to say the S word. But suicide is the second leading cause of death for individuals between 15 and 29 years old. Risk factors for suicide include previous suicide attempts, excessive drug and alcohol use, prolonged depression, financial difficulties, serious illness in oneself or a loved one, and loss of a loved one through death or rejection. Lesbian, gay, and transgender. People are significantly more likely to have thought about or attempted suicide. Nearly 4 times more men die by suicide than women. The most common method for men is firearms. For women is poisoning. In most cases, not all, but most, suicide does not occur unpredictably. There are several common warning signs of suicide intent. Recent loss and seeming inability to let go of grief, our history of depression, change in personalities such as sadness, withdrawal, irritability, anxiety, change in behavior. Like if somebody all of a sudden drops all of their sports or drops out of college. Also inability to concentrate, loss of interest of activities that used to interest us before. Change in sexual interest is a warning sign. Expressions of self-hatred. Change in sleep patterns and or eating habits. A direct statement about committing suicide. And indirect statements such as, you won't have to worry about me anymore, or, yeah, well, I guess you'll miss me when I'm gone. Those are things to be taken seriously. A couple of other warning signs are final preparations. People writing notes, preoccupations with death themes, right? Like I'm thinking about death all the time, or I'm talking about it all the time. Marked changes in personal appearance. So somebody who once was very well kept and taking care of themselves and suddenly just doesn't care about their appearance anymore. So these are some warning signs, but it is not definitive that it's not causation. There is correlation. So causation and correlation are different. Cause is one thing, cause is another. Correlation are these things correlate. There's a link, but one does not necessarily cause the other, but they correlate. Preventing suicide. And what I believe is one of the biggest preventions of suicide is talking about suicide, so that it's not a scary thing to talk about. Monitor warning signals. Take those threats seriously. Let the person know how much you care about them. Ask directly, are you thinking of hurting or killing yourself? Are you thinking about suicide? Do not belittle the person's feelings. Like, oh, come on, man, just get over it. That's probably one of the worst things that you can say to anybody who is experiencing any sort of struggle with their mental wellness. Help the person think about alternatives to suicide, right? What do you have to live for? Tell your friend, spouse, partner, parent, siblings, counselor, this is not your responsibility, right? The wellness, the life of another human is not your responsibility. And so what I want to encourage is that you question, right? Ask directly, are you thinking about hurting yourself? Respond. You know what? Tell me about some things you have to live for, and then refer. Let's get that person help, the help that they need, professional help. So although estimates show that 20% of adults have some kind of mental disorder, only 13% of adults use mental health services. So encouraging both yourself and others to seek help if you feel that you need help or feel out of control. You experience wild mood swings or inappropriate emotions. Your fears or feelings of guilt frequently distract your attention. You begin to withdraw from others. You have hallucinations. You feel inadequate or worthless, or that life is not worth living. Your daily life seems to be nothing but a series of repeated crises. You are considering suicide. You turn to drugs and or alcohol to escape your problems. Self-help books can be amazing, but be cautious when turning to self-help books, because just like you shouldn't diagnose yourself, you also should not consider treating yourself if you really have mental illness going on. Common stigmas around people with mental illness include being dangerous, irresponsible, and requiring constant care. The stigma of mental illness often leads to feelings of shame, guilt, loss of self-esteem, and self-isolation and hopelessness. And so I encourage you to think about, would you stigmatize somebody who had diabetes, right, for taking insulin? We wouldn't. They need that to survive, just as somebody who has something going on mentally, right? It's just a part of our biological function, our brain, right? Let's talk to somebody and let's get that worked out. So let's not stigmatize this. Again, part of being healthy is knowing when we need to ask for help. There are several types of mental health professionals, and they offer help and treatment for psychosocial problems. And so knowing what it is you're looking for and what is in your best interest. So anywhere from a psychiatrist who will prescribe medications and may have admitting privileges at a local hospital, psychologists, clinical social workers, counselors, psychoanalysts, therapists. So just understanding, though, when we talk about having admitting privileges to a local hospital, all of these professionals are mandated reporters for suicidal and homicidal ideations. It is part of their ethical construct that the safety and well-being of their clients and the community is held as number one regard. So some questions to ask yourself and the therapist include, can you interview the therapist before starting treatment? Most therapists will have like a short bio on a website, so you can kind of gauge if you're going to work well with that person. Do you like the therapist as a person? There needs to be a therapeutic relationship, so it's important to like your therapist. Is the therapist watching the clock or easily distracted? If you're in therapy and the therapist is constantly like looking at their computer or phone, that is not okay, because that is your time and your time is valuable. Do they demonstrate professionalism? Will the therapist help you set your goals and timetables? So part of going to therapy is you do treatment planning, goals and objectives, not unlike our behavior change contract that we did. So the first session in therapy is kind of like you and the therapist getting to know one another and seeing if you're a good fit. Before your session, there should be an intake process, which is explained to you what fees are and what expectations of therapy are. You'll then have what's called, usually it's called a biopsychosocial, and they take down your history and details about the problems that have brought you in, the presenting problems. It's important to be honest and open in this part so that you get the correct treatment that's needed. Don't expect the therapist to tell you what to do or how to behave. That's not their responsibility. They are someone that is there to walk on a journey with you, and you know you best. No other person on this planet knows you as well as you know you. So some of the treatment models, psychodynamic therapy focuses on the psychological roots of emotional suffering. Like, where does it come from? Let's go back to usually a lot of times childhood. Interpersonal therapy focuses on social roles and relationships, how we interact with others. CBT, cognitive behavior therapy, focuses on the impacts of thoughts and ideas on feelings and behaviors, and is probably one of the most commonly used modalities. These are all evidence-based, and so what you want in a therapist or somebody that you're working with is someone who utilizes evidence-based protocols. In addition to the therapeutic process, there's also pharmacological treatment, psychotherapeutic treatment, which often combines talk therapy with drug therapy. Psychoactive drugs are medicines that alter chemicals in the brain and affect mood and behavior, such as anti-anxiety and antidepressants. Potency, dosage, and side effects of the drugs can vary greatly, and it is vital to talk with your healthcare provider and to completely understand the risks and the benefits of the medication prescribed. So this concludes our lecture. I know this one went a little bit long, but I really couldn't leave anything out of this chapter because it was all pretty vital information. May you be well, take care of you, and I'll see you soon.